Hello, my name is Jennifer Moury. This is for EDU 112, and my paper was on hearing loss. So, as an introduction, there are approximately 66 million children in U.S. schools today. Of those, approximately 4% of them, so about 2,600,000, are diagnosed with a specific learning disability. And there are 10 different classifications of disability. There are mentally handicapped, learning disabled, emotionally unstable, those who have a traumatic brain injury or socially maladjusted health impairments, orthopedic impairments, special health impairments, multiple handicapped, blind and hard of hearing, and then deaf and hard of hearing, blind and hard of seeing, and then deaf and hard of hearing, which is what I'm going to be focusing on. So hearing loss. Approximately, there's a large number actually of children who have some degree of hearing loss, and it's 1/6 of the U.S. children. It's separated into two categories. Deaf, which those who are deaf can hear sounds 90 decibels or higher, which conversational speech is 40 to 60 decibels. So they really can't hear conversation. They rely on a visual communication almost completely. And then there's hard of hearing, also known as partial hearing, and it's not as severe, and oftentimes people who have it can communicate with assistance, like with some sort of hearing aid. So reasons for hearing loss. There could be, there's lots of different reasons for why someone has hearing loss. It could be a genetic thing. It could be that their ears didn't form correctly before birth. It could be complications during birth, injuries, a hard hit to a head, or loud noises. There's a variety of reasons. So hearing loss. If you are concerned that somebody might have hearing loss, there's some signs you can look for. So in young children, it might be a lack of or reduced attention, a lack of or reduced vocal interactions, and a lack of or reduced language development. For a little bit older, for school-age children, they could be very frustrated with school and with people. They could have low or dropping grades, and then there's like a lack of attention that they might have as well. And then, so if you suspect that a child in your classroom has hearing loss, there's a process that you should follow. First thing, you should consult the parent. You should ask if they had any previous concerns when the child was younger. You should ask if they have a learning disability. You should know that as a teacher, but you need to make sure that they see if they have a learning disability diagnosis. Then you should ask with the family history if there's any signs of hearing loss or in the past, or if there's developmental or communication problems in the past with their family. If the child's bilingual, that could be a good sign that maybe it's not actually a hearing loss, it's just miscommunication, a developmental delay. And then you should, if all of these have been ruled out, you should test for dyslexia. Now, if everything has been ruled out, they should be referred to an audiologist for an examination. And then we have like a couple of quotes here. If there's any question about a child's ability to hear, he should be tested. Sorry, not quotes, but just little information. And then also, the most important thing to consider to help any child with a disability is early identification. That's crucial. Okay, so the first challenge I'm going to talk about is school success. These children who have a hearing loss or hearing disability are likely to have lower grades than their peers. They shouldn't be, but they're normally 1 to 4 grades behind their peers who are the same age as them. And it's not at all, they don't have a lower IQ. It's not at all that they're less intelligent. So why? There could be delays in language and speech. That's pretty common with people who have a hearing loss. And they might not be understanding directions or your lessons, and they might be too shy to ask for repetition. They might be embarrassed to ask. So 90% of the information a child gains is from hearing conversations going on around him. So strategies to help with school. A lot of teaching modifications. The teacher needs to remember to face the student so that they can read your lips and so that your voice is be going towards that student so that they can hear it better. And then visual lessons that could be really helpful. Whiteboards, PowerPoint, handouts. Just your child's going to rely a lot on his eyesight since his hearing is impaired. Remember to repeat. When you're repeating, don't rephrase, but repeat exactly, because if you rephrase, your child's just going to have to figure out what the second thing you said, what it meant. So repeat exactly what you said before. And then a second strategy, communication and teamwork between home and school. That is very, very important for any student, and then more specifically for any student with a disability. You need to make sure that there's a lot going back and forth between the home and the school so that they can check up on each other and see how it's going. And then just one thing about teaching modifications. The average classroom is much noisier than a learning environment should be. So you can try to lower the sound in your classroom. My second challenge is going to be social consequences and self-esteem. So these people who have hearing disabilities, it's not always visibly obvious. And so they might be subject to their peer scrutiny because they talk differently, they take longer to respond, they don't understand, they speak a lot louder, and their peers, just children in general, tend to respond negatively to things they don't understand. And then self-esteem, because of this peer scrutiny, self-esteem can be lacking. It's hugely important for children and adolescents to have a high self-esteem because they're easily influenced by their emotions, and so if they think that they're not worth the teaching, they're not going to put in their effort to do their part in the learning process. Then they're going to be being excluded. They not necessarily are going to be, but that could likely result because of the peer scrutiny. So they might be excluded, and that can lead to feelings of isolation and loneliness. And then finally, they might not feel good enough. They may not feel that they are normal. They may not feel worth the extra effort. So you can, your students are going to be facing a lot of social consequences. Many students who have learning disabilities are going to be reserved and not want to participate in different classroom activities because they don't feel good enough, they've been excluded, their self-esteem is lacking, and their peers might be not very kind to them. Okay, so strategies that can help with self-esteem and socially. American Sign Language. It's a visual language. I think most people have heard of it. There's hand shapes, directions, emotions, facial expressions, and body language. It is beneficial for all children. Most schools, I believe, don't teach it or don't have it required. If you can convince, if some of the children in your classroom do know that, that can be hugely important to your child who does have a hearing disability. So that would be like optimal. However, most schools don't teach it, and so there needs to be some other way for children who have a hearing disability to be able to communicate with their peers, with their classmates. So we have the Picture Exchange Communication System. It's also known as PECS. It's when the student who has a hearing disability or any sort of communication problem has a little binder or even a bracelet that has different pictures on it. And so he gives or shows these pictures to somebody else to make his needs and desires known. And it can also be helpful in helping him to initiate conversation, which in turn will build self-esteem and can help a lot in the social areas of his life. Okay, so as a conclusion, small changes in the classroom can be exactly what a child needs to succeed, thrive, and graduate. It's a lot up to the teachers. There are fancy technology, but those things may be very expensive and just may not be available to all students. So a teacher's job is to make these small changes that will help. And then allowing children to communicate in ways other than verbal speech. This is going to allow them to advocate for themselves, which will help them see their self-worth and how valuable they are to their classroom, to their family, to society in general. Finally, it is the teacher's job to promote and support the inclusion of all students and help each student to achieve his greatest potential. So it's really a lot of it relies on the teacher. He can have a really big role in helping the student to grow socially and to grow academically. And then here is my bibliography. I use these sources on both pages here. I believe that finishes my presentation. Thank you very much for listening, and I hope you enjoyed it.